Okay, so we will start by the occupational English test preparation, free samples. Okay, we will download writing, reading, listening, speaking, all of this. Once we have downloaded this, keep this. Okay, I will start doing reading. So I will do. I will start my day by writing. So I will download this. Okay. By the way, this will be available on the official website. You will click medicine. Okay, and you will see this is the free sample. And by the way, the exam will be like this. Okay. The notes, this is the case notes. You will not start by reading the case notes. You will start from here. Okay. What is the writing test? Using the information in the case notes, write a letter of referral for further investigation and definitive diagnosis to the gastroenterologist, Dr. Jason Roberts at Newtown Hospital, 111 High Street, Newtown. So I will start reading the case notes after reading the writing task, because I will start my letter from this. I will show you the writing answer of this. Okay. Okay, writing test, writing sample. Okay. Writing test sample. Yes. Yes, this is the answer booklet. By the way, you will need to print this to get use of the writing paper of writing. So you will download this too and print it many copies for you to write from the beginning. So this will be the answer booklet. By the way, this will be 2 separate papers. Okay. Don't know what is the problem. Can't see this. Yes. Okay. Yes, this is the answer. Okay, how you will write? I will close the camera. Okay, and I will flip it over like this. You will write like this. Okay. You will start by writing Dr. capital Jason Roberts. Okay, like this. The specialty of the doctor. You will not written, but you will write gastroenterologist. Okay, then the street in lines, capital letters. Newtown Hospital, 111 High Street and Newtown. Okay. Once we have finished, this is the address. Okay. Then you will leave a blank. Then you will write the date, today's date, which will be written like this. If you will, your test is 20 of March, you will be right like this. Okay, day, month, and then year. Okay. Here you will leave a blank after the date and write dear doctor, the second name of the doctor, Dr. Robert. Okay, so you will write dear Dr. Roberts. Okay, you will not leave a blank and write re or regarding or subject is an whole date of birth. You will write the date like we said, like this, not like this. No problem, but we want to make our formula fixed and constant. Okay. Thank you for seeing Mrs. Hall. A 40, yeah, you will write all this like this. Okay. The same format. Patient age, name. You can write the occupation. You can write student, widow, whatever. Okay, and write 2 commas. Who is presenting or whose symptoms are suggestive of. You will read many formulas of the first introductory paragraph. Then you will write only the specific complaint. Okay, here he is increasing, so you will write like this. The final complaint you will find here. Provisional diagnosis is gastroesophageal with possible fracture. Okay.
Hello?
Okay.
خلصت ولا لسه؟
Okay. So you will write like this. Okay, the final gastroesophageal reflux disease with a structure. This is the final diagnosis. So you will write who is presenting with a 2-week history of a 2-week. This is called a compound adjective. A 2-week history of what? Gastroesophageal reflux disease with possible structure. Full stop. Your further management would be highly appreciated. Okay, so we have finished. After this, you will write the second. This is the introduction. So you will write like this. Thank you for seeing Miss Hall, a 45-year-old secondary school teacher who is presenting with gastroesophageal reflux disease with a possible structure. Full stop. Your further assessment would be highly appreciated. Full stop. You have finished the first paragraph. Okay. The second paragraph will be only social and medical history. The patient is a smoker, non-drinker, whatever, and the medical history. She has been suffering from diabetes, for which she has been on metformin, whatever. Okay, so drugs, how you will write the drugs? Okay, if the aspirin is sold in the market, the trade name will be written, always will be written like capital letters, like metformin, whatever. But the acetyl salicylic acid will written acetyl salicylic small letter. So if the active ingredient, you will write small letter. If the drug is the trade name, you will write always capital letters. Okay, like okay, and all abbreviations written completely like non-steroidal anti-inflammatory drugs. So this is the drugs. So the social and medical history will be written in the second paragraph. You will leave blank between each paragraph. So you have 2 paragraphs. I will show you something. Okay. Okay, here I will show you this. Okay, this is the ideal letter format. Okay, introductory paragraph, 2 sentences. You will write from 25 to 30 words. 2 sentences, you will keep them like them. Okay, like as it is, don't change. Okay, once you have finished the introductory paragraph, you will make 3 bodies, okay, or 3 paragraphs. This is those are the visits, 2 visits or 2 to 3 visits, and the second one will be social and medical history. Okay, the second, this is the introduction, this is the body, first body or the paragraph, the first paragraph of the body, and the second paragraph of the body will be in between the visits. You may write initially, on, date, she presented, she came. I will show you many examples. I will give you all benchmark corrected letters. Okay, I will give you the full drive. I have 30 gigabytes occupational English test. I just studied only 5 gigabytes. So don't try to download. Dr. Badr, he got A, and C+ in writing. I'm very sad for him. He got 3 A's. I surprised. A speaking, A listening, A reading, but C writing. So don't try to increase the dose of the material and you will not study. Okay, try to be concentrated and revise what you have done. Download one single material and finish them. Don't try to collect all materials in the market and start to do them. No, this is wrong. So I will complete. This is the initial visit. This is then you can write here a second paragraph of a visit, and the final visit, today's visit, or on today's presentation, or today. This will be present or past simple. I will show you the final written and corrected by benchmark letters. The conclusion also, you will fix it. Don't say, no, this is repeated. No, it will not be repeated. I promise you. Many wrote the same format, and they passed. Got 4 B's. You have to got 4 B's. Regarding speaking, don't be afraid. Regarding listening, don't be afraid. Reading and writing, write as much as you can and send on the group for us to correct. Don't be afraid. Reading, no. Try to be careful of reading. Okay, I will show you all of this now. طيب شوفوا اللتر ده. كويس، مفيش مشكلة. اللتر ده متصحح، هيتصحح كالآتي. انت الأول عملت اسم I don't know if there is England. Dr. Lijo, Dr. Iknur, okay, I have to speak in English. Okay. So look at this. This you will write exactly like this. Dr. T. William, Tanya William. Okay, all will be like this. Dr. Tanya William. Okay, the specialty, respiratory specialist. All this has been written right. Bayview Private Hospital. By the way, the B capital is like this. This is a be small. Don't forget, I'm not telling jokes, but many wrote like this: respiratory, like, or private hospital written like this. Will be a fault, a mistake, and will be assessed. So this is a private. This is right, written right. Okay, and then the date. Then the final address. Sorry, this is the full doctor name, specialty, address. Okay, we finished from all of this. Then we will leave a blank and wrote the date. Then the date will be wrote completely like this: the date of the visit. Okay, the date of your exam. Then هتسيب خط. You will leave a blank between this and this and write dear doctor, second name, dear Dr. William, and comma, regarding or subject or colon, and Mr. whatever, Mr. Foster or Mr. Footer or Zich Foster, whatever. Okay, date of birth like this also. Okay, date of birth. All of this will be written right. Then you will leave a blank, and here in the first paragraph, from a formal point of view, to leave some space here and write, thank you for seeing Mr. Foster, comma, a 20-year, yes, not years, year-old builder. Okay, this is the occupation. So you will put comma, and this will be single, not plural, and you will hyphenate the compound adjective of the single builder, so it will be a 22-year-old builder, comma, whose features are consistent with uncontrolled asthma. Okay, comma, sorry, full stop, and you will write your, sorry, like this. Your further assessment or management would be or is highly appreciated or would be appreciated. Full stop, and start to leave a blank, and here social and medical history. Mr. Foster is a single smoker. I think this will be wrong because he is a single man and he smokes, but a single smoker will be, someone tell me it will be wrong. He wants to tell us that Mr. Foster is single. Okay, he is a single man. You can put a full stop and write moreover. Okay, he smokes, whatever. Okay, and who has Mr. Foster is a single smoker who has a long history of you will keep in your mind that a history will take an article. A long history of asthma, which required hospital admission twice. You will add fancy words and you will add full stop. Don't write one sentence, then full stop, then one sentence. This will not be exciting for my eye to read or for the examiner to assess. No, try to add additionally, furthermore. After additionally, you will put a comma and write a new sentence, or furthermore, or nevertheless, or hence, or that, or in addition. Please note, all of these are called fences, or because you have to add therefore, however, they're not fences, but I mean that this is to make sentences exciting to read. Okay. So I will finish. He uses Aventolin and Palmicort regularly. Please note, yes, this is good. And here written therefore, very good. Please note, comma, the patient has eczema, hay fever. Okay, all of this. Okay, very good. And is allergic to cats. Full stop. Moreover, his young sister is also asthmatic. This is a positive family history. Okay, you will ask me how to choose case notes, how to select, and how to drop the case notes. I will tell you something. Don't be afraid of this. Right, because you are a doctor and referring to a doctor. Be oriented. What is relevant to the patient case, and what will be important for the doctor you will refer the case to him. Like, if I have some patients which suffer from cancer, and in my case note the patient written that his sister has cough or his mother died of diabetes, will that be relevant to the case of cancer management? I will refer to a doctor for further management? No, this is irrelevant. So don't try. Don't be afraid. How to choose all of this? No, drop what you want to drop. This will not affect your writing. Writing assessor will not be a doctor, so don't worry. The importance, I will show you the assessment criteria. Okay, so here written diseases, social history, family history, diseases, drugs, all of this the first paragraph. Okay, then we have finished. Here, the patient initially presented with worsening signs of asthma, comma, blah blah blah. He will write furthermore, he complained, and the comma, he complained of burning sensation, blah blah blah. Okay, all of this. Thus, this is called thus, semicolon, small letter of thus means وهكذا, or so, or furthermore, thus, or so, like therefore, between two sentences. A relative clause will come after that. On examination, upon examination, his examination showed or revealed. I will show you many letters, and you have corrected letters before you write. Okay, consequently, subsequently, comma, counseling of the patient for quitting smoking, as well as importance of the medication, compliance were done. Okay, then you can divide this into two paragraphs. This will not be a problem. Today's visit. Today, Mr. Forster, unfortunately, perfect, or fortunately, or regrettably, or interestingly, those will raise your level. Okay. Non-compliance medications. Furthermore, okay. Therefore, and asthma was discussed, and all of this. Okay, full stop, leave a blank. In view of the above, this is a conclusion. In view of the above, in the light of the above, based on that, based on the above, you have to conclude or finish the conclusion with a strong vocab. Okay, like all of this. In view of the above, therefore, or finally, lastly, in the light of the above, based on that. Okay. In view of the above, I'm referring this patient for further assessment and management for his asthma. For further, yes, these two sentences. I will refer, why I will refer, and that's the final sentence. For further queries, please do not hesitate to contact me. Or should there be any queries, please do not hesitate to contact me. Or should you have any queries, please contact me. Whatever you can change, and you will write the final will be written like this. Yours sincerely, Doctor. This is the end, and here you will leave. You will make a comma. Yours. This is capital, and this is small, and this is small. Keep this. We have finished. We have finished. So you have done today's writing. You will listen to master classes. This is free, by the way. Watch them online. So we will see occupational English test preparation, portal free, and occupational English test master classes. You can click watch now and watch. Okay, master classes are free and perfect for you to watch. You will subscribe, no problem. All of this will be free. After this, you will see this man. This man has got a partnership, official partnership with the Occupational English Test website. So don't worry, Jay is trusted, and you will benefit from him. After that, I will give you the full drive. How to start your day. Tomorrow I will get up in the morning. Okay, I will write a letter. Okay, those will be 20 days, only 20 days to pass. Write a letter, send it to 2 to 3 of your friends to correct. Don't worry, even your friend is not perfect in English, he will detect your faults, but you will never detect yourself faults. So after that, you will download E2 full tests. Reading, you will practice. After writing, you will practice reading. How to solve reading, this will be with J, this man. You will write J speaking OET 2.0, okay, and finish all his classes. Don't say, I will never, I'm not good in English. No, occupational English test is not an English language test. This is a system. And if you gonna be oriented with this system, you will definitely pass in 20 days. I'm sure of that. I have passed. I was busy, you know that I have done occupational English test before my Part B MRCS. And I was busy between, so I finished. Every day I do writing, then reading, then listen. Always listen, try to write, how to listen. Part A, Part B, Part C. Also, you will follow this plan. Occupational English test, master class, you will download and follow the class, and then download this and watch J. Or watch J and then download these practice tests. So don't be hesitated. Those are the official, okay, and you will be okay with them. I am sure occupational English test will not, from now, go to March exam and book it and start to do every day. Get up early, do writing in your word or clinic, do listening, do reading, timed reading, you adjust your clock, do reading, do listening, and at night like this, meet your friends on Zoom and do speaking. How speaking will be done. I will show you some of the speaking orientation. Okay. Sure. Okay. This will be two cards of this are the two of these are will be with you for okay. This will be cut from here and given to you, to the actor, sorry, to the interlocutor. Okay, then this will be given for you. You will read your task and make the fulfillment. Tuesday, I will be with you for speaking orientation. How to speak, how you will show empathy and sympathy to the patient, how you will confirm your information, how you will end and summarize your conversation, how you will manage the reluctancy of the patient. Would be right to interrupt the patient and tell him, I'm a doctor, you have to obey my orders. No, you have to be excellent, skilled doctor. So this will come with speaking with my friends, and some people will watch you and judge each other. I have practiced like this, and all of us will practice like this. We are 7 now. Okay, we'll start by doing, I can open the mic for all.
حتى قال لك يا عبد رأيك ايه؟
Go ahead
قال له
with,
ماليش دعوة.
you have to go ahead with the evidence.
Okay, I have to know who want to do speaking. Dr. Iknor, are you ready?
No, actually.
Not ready. You will take the rule of the patient, no problem, okay?
Actually, I'm not sure about it. I just wanna watch you and today, maybe the other day. I'm gonna start to speak.
No problem. Next, you will be. I have my session with you yesterday, and you are good in English, so don't worry of speaking. You will speak like you are better than me in English, so don't worry. I'm Egyptian, not an. And you are Turkish, right?
Yeah, that's true. That.
Okay. Dr. Ghada is busy. Dr. Ahmed, are you ready? You are not ready. Okay. Dr. Mina Nader is not ready. Okay, so how you will be ready for speaking? You will watch masterclass, you will watch Jay, and we have a meeting on Tuesday, because I will say, good afternoon, I'm Dr. Reda, one of the exam or one of the doctors here today. Will not start like this. It will start like the interlocutor will tell me, I will not record before I have a warm-up session with you. What's your name? I'm Reda Harbi. Okay. What's your profession? I'm a doctor. I'm a surgeon. Okay. And for how long have you been working as a doctor? I will tell him, actually, I'm working, or I have been working as a surgeon for the previous 5 years. He will tell me, good. And why did you choose, or why did you select this profession among many professions in front of you? I will tell him, actually, I want to save lives. I want to save people from saying or from suffering. So actually, I found out that medicine and surgery will cure patients and save them from suffering. He will tell you perfect. Yes, we have finished, Dr. Reda. We will start now. We have finished our warm-up session. We will start now doing the actual assessment, the actual speaking that will be assessed. But the warming session will not be assessed. We have finished warming. Now we will do the actual session. We will start me. I will start by giving you this, Dr. Reda. Okay, I will take it. He will cut this like this and give me the doctor rule, and he will take the patient rule. Role play will be easy. Don't worry. You are a doctor or a nurse or whatever. You are skilled and prepared well to speak with him. So don't worry at all. You will take this. Okay, and start doing your role as a doctor. Okay, you will read middle-aged patient has yeah complaining of 2 days ago or whatever, and you will finish this. Then rapidly you will have only 3 minutes to read, 2 to 3 minutes. Okay, you will read, check the patient difficulty, you diagnose gastroesophageal reflux disease, alcohol use. Okay, bad smoking, bad posture, outlines the dietary and lifestyle measures, advise on treatment strategy, Ranitidine, H2 antagonist, reassure the patient. Here, the interlocutor will take his rule, find out what is causing the symptoms. Because you are a middle-aged and overweight, you have noticed a better taste in your mouth, worse in the morning, and accompanied by burner sensation. I don't try to read. Yeah, burning sensation. I think in the back of your throat. You have also noticed it is worse during your morning walk after breakfast. Sometimes there's a bit of regurgitation of food. You smoke 5 to 10 cigarettes a day, drink several cups of coffee, and have 2 glasses of wine with dinner. You also have a slight cough when you speak. Find out what's causing these symptoms. When the doctor mentioned reflux, become alarmed. You have heard that it can lead to a serious precancerous condition. Find out how it can be treated. Do not accept the doctor. This is a reluctance. He will not accept your recommendations. You feel he or she is not taking his seriously enough, and you want to see a specialist. Be insistent. Reluctantly accept the doctor's advice. Okay, so we have came now here. Okay, doctor, you have finished? Yes, I have took my 3 minutes and I have finished. I'm ready. He will have a record in front of him. He will start pressing on the record. From this moment, your speaking test will be assessed. First, is this the first visit or the follow-up or second visit? If this is the first visit, you will not ask the patient. You will ask the patient about his name, because you are not familiar with the patient. So you can ask him, "How can I address you, sir?" Or "How can I address you?" By the way, don't tell the patient, "Sir," because this is from the beginning. You have to make him understand that you are a doctor and he is a patient, whatever the level, standard living level. Okay, then if this is a follow-up visit, you will not, you tell him, "It's been a while," or "Oh, it has been a while," or "How are you, Mr. whatever, How are you today? Miss you. Have a seat. Or, but here you don't know the patient, so you will ask about name. Here's the second or follow-up visit. You will not ask about name. So, hello, good afternoon, Dr. Reda, one of the doctors here today. This is the first visit. How can I help you? No. How can I address you? I'm Dr. Ahmed or Dr. Iknor or Dr. Reda, whatever. Okay, welcome, Dr. Ahmed. Have a seat, please. Okay. Okay, this is a second visit. Oh, hello, how are you? It's been a while. Have a seat. How can I help you today? What's the problem since today? Whatever. Okay, I will start doing like this. Okay, I have finished. Sit down, have a seat, please. Okay. Okay, he will, after you tell him what is the problem or how can I help you, he will tell the symptoms. You will show sympathy. Oh, I'm really sorry, and don't be like I am actually. Don't try to be flat person. Try to show intonation of your voice. Oh, I'm really sorry to hear that. Oh, actually, it must have been very painful for you. I really appreciate your concerns. Like this. Don't smile. Don't laugh. I'm not telling jokes. I'm speaking seriously. You have to show intonation, and this will assist in your speaking. Pronunciation, intonation will not be assessed, but I think they like you a skilled doctor. Okay, so I think this will add points for you. Okay. So I'm really sorry to hear that. It must have been very painful for you. But let me ask you some question. Okay? You will ask about the symptoms like any doctor. You want to know if this pain. You will ask about secrets. Where exactly is the pain? Is it accompanied by any other symptoms? When did exactly it start? All of this. Is it increasing, decreasing, or stationary? You will ask about some questions about the symptoms. I will give you the perfect history or the perfect file for speaking of OET. I have done it and I recommend it for you. I will give you Dr. Islam Haji. Okay. Then he will tell you the reflux, and you will tell him actually this is what we have called GORD or gastroesophageal reflux disease. Have you heard about this disease? He will tell you actually I know that this is I see you know well. Let me explain more about this gastroesophageal reflux disease. This is a disease of the junction between your stomach and food pipe. You will tell him the disease in terms, but you will explain in layman language what does these terms mean, okay? Then you will tell him about his disease. Then he will ask you, this is a precancerous condition, I'm afraid. Don't tell him this is not, don't be direct from the beginning. Okay, be direct, don't try to skirt around the patient, okay? But you have to show him sympathy because this is a patient and he's gonna be treated on your hands. So you will tell him, oh, I really appreciate your concerns. I really appreciate your fears. I really, whatever. Okay, you will be better than me in this. After this, but let me to tell you that If this long-standing on long term, actually, yes, this will increase the risk of cancer. But don't worry, if we have it treated earlier, it will not be a problem. He will ask you how could be this could be treated, doctor. Okay, we will make a lifestyle change. We will do. Don't use the same words even in writing. Try to paraphrase. What's paraphrasing is to change the word in the case notes to its synonyms. What are synonyms? Synonyms are the other meaning of the same words. You have to increase your vocabs in order to change and play with the vocabs in front of you and change to another. Don't tell elevation of the head. Avoidance, don't tell like this. This will make you in mistakes. No, try to be, we will make lifestyle modifications, like we will practice exercise to lose weight, and we have many food stuffs we have to avoid, like junk foods, like try to increase. This will not be a problem. You are a doctor. Don't be limited by these words. Try to change them to their synonyms and add or to subtract from them. Don't worry. He will refuse your medication. He will tell you, no, doctor, but this, I really appreciate that you refuse this treatment. I feel your concern, but actually, in my place, in my position, the guidelines, the WHO guidelines, reported that the severe reflux disease will strictly be treated on 1, 2, 3 manner. So don't be worried. You are in good hands. Try to reassure him. So you will. From the first, he will be reluctant. Try to show sympathy. Try to be sympathetic with him. Then flow the information as a doctor. Then reassure him. So don't give the information in bullets. No. Understand his concerns. Give the information. Then reassure him that he is in good hands, and we are expert in treating such diseases. You are not the first one to try to change whatever. You are a doctor. Don't be worried. Don't worry, sorry. Then he will refuse. Okay, refuse. Even don't be disturbed. You have to manage your stress. Be like a doctor and tell him, as I have told you, I try to emphasize that you confirm what you have mentioned, okay? But as I have mentioned, sir, that this condition, if not be treated, it will be a problem. But if you follow our instructions, this gonna be okay. Are you following me? So you during your speech, you have to tell him, are you following me? Is that okay with you? Is that working? Am I clear? Is that clear so far? So you have to vary your speech. Don't every time tell him, are you following me? Are you following me? No. Or is that clear so far? Is that no? Try to change from this to this. Try to play with with the synonyms and with the sentences. Try to be variable. At the end, he will accept. Then try to be rapid, because only 5 minutes are allowed for you. Okay? So don't worry. Don't be slow. Try to be quite rapid. After this, you will tell him to summarize, or in summary, we have been through your disease, which is called severe reflux disease, because of your smoking habits, because of whatever And the treatment will be lifestyle modification and some drugs like ranitidine, which is H2 antagonist, and you have accepted this. Okay, sir, thank you. Do you have any other concerns? No, thank you, doctor. Thank you. This is the end. You will get B definitely in speaking, I'm sure. Speaking is not gonna be a problem in your exam, don't worry. Do you have any? I will open mics for all. After I will stop the recording.